Good afternoon and welcome to Living Well with Adena. I'm Dr. John Gabus, Medical Director of Community Partnerships, and we're so glad that you've taken the time to join us. Today we're going to be talking about an area of collaboration and partnerships that's very, very important to Adena. How do we help our local businesses, schools, community organizations, other healthcare organizations help people to achieve health and to maintain their health? And our community needs are very important because we are called to serve our community. So we're here to talk about community service and living our mission of being called to serve our community. With us today, we have three guests. To my left is Kim Hardesty, who is the Community Health Worker Supervisor at the Ross County Health District. Next to her is Kim Jones, who's the Director of Community Health and Development. And Megan Batson, who is from our neighboring county of Fayette, and she's with Fayette County Public Health. Yes. And she is the EMA coordinator there. So we all have unique roles to play in our communities, and these folks will tell you about what they do to help you achieve your health. So let's start with you, okay. Kim Hardesty.
All right. Well, thank you for having me here. I work with the Ross County Health District, and I'm in the Health Promotions Division. And in the Health Promotions Division, we work on programs and we have grants in the community. And the purpose of those grants is to help with better health outcomes for our residents. So we work on chronic disease prevention grants and try to increase awareness of health opportunity for health outcomes in the community.
Great. And Kim Jones.
Hi, I'm Kim Jones. I serve as the Director for Community Health and Development for Adena Health System. One of my primary tasks is to work with our collaborative partners out in the community to complete community health needs assessments as well as community health improvement plans. We would also work on a lot of different projects with Adena as well as with our community partners on programs that help address some of those needs and priorities that we've identified out in the communities.
Okay. And Megan, welcome to Living Well with Adena. Tell us a little bit about what you do and your role.
My role is the Emergency Preparedness Coordinator for Fayette County Public Health, which does all the planning with COVID, all the pre-planning that happened before it, and then the planning that we did afterwards. And then I assist in the accreditation with multiple of us doing the projects. So.
All right, great. So welcome all of you. And remember, if you have questions and this is live and you're joining us live, be sure to ask questions in the comment section and we'll get to those if you have those questions. So let's kick off a little bit about what is a community health needs assessment and why do we do that? Kim?
So community health needs assessments are designed really to assist communities in really understanding what all the health variables are within a community and what drives the health outcomes and factors for the population. Hospitals, nonprofit hospitals, as well as public health departments are all required to do them. But it's very important to make sure that we're looking at them on a regular basis as well, just so that we are utilizing our resources within the community properly to be able to address what is really going on. The assessments utilize data such as census data, public health data from the Ohio Department of Health. It looks out at health prevalence, health outcomes, what kinds of health behaviors people have. It also goes to the lengths of really going out into the community and asking them how do they feel about the state of health? What are the resources that they feel that they need the most? What barriers and those types of things that they're facing at the time in order to achieve better health? And you take all that information and you put it together and you analyze it and you get together as a group and then really try to figure out what are the priorities here? Can we prioritize? What resources do we have, not have? Where could we have the most success in being impactful? And you really develop what they call a CHIP, or a community health improvement plan around that. And as a collaborative and as groups, everybody works together with their own parts of that to create a plan and execute it.
So is there a requirement that hospitals or communities do this?
All nonprofit hospitals are required to do one every 3 years. All public health departments, I believe, they're on the 5-year plan, but everybody goes to a 3-year.
ODH has changed the requirement to
Yes.
3 years now.
So that everybody will get on the same page.
That seems to make sense.
And that's the intention of it, is that we all try to work together, because no one agency can take it all on, and it's better for us to be working together as a collaborative.
Sure. And I'm sure that even though the IRS says you must do this, I know that if we are called to serve our communities, we can't let it just be an obligation. We have to make it be a living, breathing document or a living, breathing program, especially the Community Health Improvement Program. So how do we institute a Community Health Improvement Program using the data that you were discussing? And how do we let our community know, hey, we're making a difference or we're not making a difference?
It's really important. I think one of the primary components of the Community Health Improvement Plan is to create a good communication plan for the community. Really trying to look at every possible venue to get information out to everyone about what the current health status is, what types of things are driving it. So a good example would be something around, and we find this in all of our communities here in Southern Ohio, lung and respiratory issues are a big deal. And Kim will be telling you a little bit more about that later. But how do we get the word out about that? How do we make people understand that a lot of the bad health outcomes that we're having are related back to that? And if we're working on things on a community level that could change that, what kind of impact that could have in saving lives, year over year.
So there's so much data that we collect doing this. It would be very hard to set a priority. We can't do it all. So we must set a priority or a list of priorities.
Yes.
Because otherwise we'd be doing a little bit on each of the subjects or each of the topics or outcomes or factors, but we really wouldn't make a big push and have some improvement. So what are some of the areas, you mentioned lung and respiratory, what are some of the other areas that we know that are critically important to the health of our community? What are some of those areas, and how are we approaching that?
Some of the other areas, and I think you could talk about Fayette County as well. I mean, like in Ross County, for example, some of the other areas are, obesity and diabetes. Mental health and substance use disorder are two very important topics as well. Child safety and wellness, looking at more infant mortality rates and some of those other things. Those are really kind of the health issues, but there's also some of those underlying issues too that we had to prioritize underneath that as well. But I think in Fayette, you probably see some similarities.
Ours were very similar. With our first child that we did in 2017, we saw substance abuse and mental health, and then chronic illness, specifically diabetes at that point in time. And then actually the big thing we found was our schools, as we were talking to the kids and stuff, there wasn't health classes really happening except for their freshman year. So we went into 5th grade with a Healthy Kids Fayette County, and did like just an exercise, general hand washing, that type of thing, nutrition, just to give them a little basics. And we did that for the year of 2018, 2019. And then last year we didn't get into the school as much as we wanted to. So we're hoping to bring that back. Okay.
Well, thanks, Megan. And how I heard Kim say some of the data sources like the census and other state Department of Health data, but that doesn't give you a flavor. That gives you a statement about health, and there's a flavor to health, I think. How has Fayette approached gathering data, and how has Ross County approached it gathering data?
We currently are doing our data collection right now. So we are doing that with sending out surveys through electronic, through email, social media, website. And this week we are actually out at our fair with paper copies, having people fill them out and try to get some feedback that way. And then we'll have them at various offices throughout the community to send out to.
Okay, so many different ways. Mm-hmm. Kim, how is Ross County thinking about adding that flavor?
With our local collection, we have surveys that we shared, electronic copies. We'll share them at public events so we can get the paper written copies as well. And then also doing stakeholder meetings so we can get the input of a specific group. And then getting out in the community and talking to individuals and seeing what their feedback is. So self-reporting as well.
Okay. So can you give some specific examples of how can a community member volunteer, or how can a community member be sure that their voice is heard? Are there ways for them to reach out?
Absolutely. We frequently at the health district, we put our surveys that we are sharing through the community specific to our programs on our Facebook page and websites. We also share them at the Ross County Fair and any other opportunity we can to share those resources. We will share the surveys. So if they can frequently check our Facebook page or go to our webpage. For instance, we're getting ready to launch a tobacco survey. We want to get the community's feedback on their views on secondhand smoke. And we're going to guide some policy development based off those survey results. So that would be a great way for the community to weigh in and tell us what's important to them.
Okay, very good. One of the key components here, and we've talked around it, no one agency can impact this. So in our community, who has Adena partnered with, Kim Jones? Who has Adena partnered with to help combat some of these trends and make improvements? So I imagine the list is kind of long.
It is, because one of the things that you really do find with these community health assessments is that there are a lot of underlying issues that really do impact people's health choices. When we do surveys, we have questions that are related to things like interpersonal violence, housing, poverty, employment, education. All those types of things can really play a huge role in whether or not someone can get the care or that they need, or even make better choices for themselves so that they don't hurt their health. And so that's why it's important that it's not just the hospital and the public health departments doing it, but partnering with agencies like Community Action, for example, that does a lot around housing and employment. We also partner with our schools who have most of the kids, across our communities every day who need all kinds of resources for them. We also look with our city and county governments as well to get them involved in things, because oftentimes, Kim talks about policies and things like that. Sometimes you need an ordinance for something, or you have to have their support around this as well. We also work with private businesses, like folks that provide transportation and those types of things that might often be a barrier for someone trying to get health care or get to the doctor or pharmacy or whatever they need. But we really do try to partner with lots of different agencies, because we realize that there are a lot of underlying factors where they might be able to play a role in supporting people.
Sure. And if we're successful at working together, those other agencies become successful at meeting their mission.
Yes.
One of those agencies is our local YMCA. And joining us today is Steve Clever, the CEO and Executive Director of the Chillicothe Ross YMCA. So welcome, Steve. Thanks for joining us today.
Thanks for having me.
Can you give us a little background about how you got into your current role, or what drove you, or what's your motivation?
That's a great question. I've been in my role here as director of the Y for the last 7 years. Before that, I was a board member for 6. I grew up here in Ross County. I was a kid in this Y. I was hoping that you guys aren't catching all the background noise around me, because we have lots of kids in the building right now. I was one of those kids 25 years ago, I guess now. And so we're very passionate about impacting our community here at the Y.
Terrific. What are some of the programs that you offer to our community that can help improve health and really impact some diseases that are common in our area, like diabetes, for example?
Absolutely. We know diabetes prevalence in Ross County is very high. Last year, I think it was 15% of our population in Ross County was dealing with diabetes. That's about twice the best counties in the state of Ohio. And so that's something that we want to address. We know that diabetes is comorbid with lots of conditions, including high blood pressure, obesity, cardiovascular diseases. And those with diabetes, we know, spend about twice the average on healthcare and medical needs. And so where we can, we want to prevent that. So we offer the Diabetes Prevention Program, which is a CDC-approved lifestyle change program for adults who have a BMI of 25 or greater and an A1C of 5.7 to 6.4. It's a 12-month program. It begins with 16 weekly sessions and then gradually reducing the frequency down with two primary goals. One is reducing body weight by 7% and increasing physical activity to 150 minutes per week.
So I heard you say it's a CDC program, so I imagine it's evidence-based.
Absolutely.
And that this program can for sure help people who are pre-diabetic put into place things that can delay the onset of diabetes or even prevent it. Um, how many folks take advantage of this program?
Yeah. So your point is taken. Yes, it's an evidence-based program. It's a program that is provided across the country at YMCA's and other community centers as well. And so there's thousands upon thousands of folks who participate in this program annually. It is a program that oftentimes is referred through a physician. Oftentimes the qualifying A1C is identified in a medical setting, and that's generally how they connect with us. Yeah, absolutely. We're trying to reach that pre-diabetic population before it becomes type 2 diabetes.
Yeah, it's pretty amazing that there's a program that with a high degree of certainty can help prevent the progression of diabetes. And if I were in that category with a body mass index or BMI greater than 25, mine is, and I had an A1C that was higher than 5.7, I would be very much in favor of a program like that. So we've talked about diabetes. I know that cancer is also occurs in Ross County at a higher incidence. What type of programming do you have around cancer treatment, around survivorship? It's called whenever somebody survives cancer and it impacts their life and their health. What are some programming uh, guidelines that the YMCA has?
Cancer is so personal. I think every one of us has somebody that we're connected to that it has impacted. I lost my grandfather when I was 12 to lung cancer. And when we saw an opportunity to partner with the Cancer Center, we wanted to find what the best option was for that. About 300 YMCAs across the country offer something called Live Strong at the Y, which is a no-cost, evidence-based program that helps cancer survivors reclaim their health and well-being after a cancer diagnosis. It's a small group program. It's twice a week for 12 weeks. It's designed to create support, connections, and rebuild that cardiovascular and strength that oftentimes is lost through treatment. And then also past participants serve as mentors through the program. So there's this mentoring component that happens through the program. And it's something that we think is central to our mission of supporting those either going through or having gone through such a difficult time.
Sure, those folks with lived experience through that very scary time, I'm sure they add a lot of comfort to those with the new diagnosis of cancer, or they're just finished their treatment. So that sounds like a very very worthwhile program. So thank you for hosting that for our region. What are some programs that are on the horizon? So I know that there's a lot of evidence-based approaches to help improve health outcomes and health factors. What are some of those that are on the horizon for you at the YMCA?
And that's foundational to what we're doing. YMCA has been around for almost 100 years in Ross County, and most people are familiar with the Y as a gym and swim. And so it's been our approach over the last 5-6 years to make sure that new programs that we develop are evidence-based, and they've been done and replicated across the area and across the country. And so the two I've mentioned already fit that mold. We have two more that are in the pipeline for us. One of them is the diabetes self-management program. We know, as I said, diabetes represents something that affects 15% of the people in Ross County. So if we can address those who are already struggling with diabetes in an effective program, we desire to. The Stanford University created a model that is designed to help folks manage their symptoms, fatigue, pain, and emotional struggles related to diabetes. And so we're striving to bring that program to Ross County in the next 12 months. And then additionally, we're under consideration right now for a national grant that would allow us to bring the blood pressure self-monitoring program to Ross County. And that teaches participants how to measure and track their blood pressure, eat healthier, and then avoid those triggers that oftentimes increase blood pressure.
Wow, those are all very important things. People with diabetes and people with high blood pressure, sometimes you need some coaching or just a little nudge in the right direction to help keep you on track. So those are great programs, and I wish you well on applying for the grant for the high blood pressure self-management program. And thank you for partnering with Adena Health. The YMCA partnership in all of our communities is a critical component. You're there to have a mission to improve the health of your uh, members and the communities, and that's the same as all of us sitting on the panel here. So thank you very much, Steve, for all that you're doing at the YMCA, and you have a good rest of the day. We're going to turn back to our in-studio panel.
You all as well. Thank you.
So Kim Jones, recently Adena's had a chance to collaborate with the Carver Community Center on a project. It's something that I know I participated in, and it just is so exciting. Talk about what Carver is up to.
Carver Community Center worked with us to put in a community garden this year. It's something we had talked with them about doing for I don't know how many years. We discussed it. They had a plot of land picked out, but the land just wasn't ready for us to be able to do it. But during COVID, they were able to make those adjustments there and get it ready. And so we dug us up some plots and put in a community garden this year that the kids actually at the center are tending this year. And we love that because one of the things we found in our community health needs assessments is that nutrition is a topic of interest. When we ask the public, what do you want more information on? Nutrition was a big piece of it. And we know a lot of people aren't getting access to the fruits and vegetables and things that they need all the time. And so putting in a garden to where we're not only providing that and making that available to folks, because Carver, many may not know, does do a feeding program during the week as well, so they can utilize those vegetables for that. But also, we're impacting the kids as well. They're learning how to grow vegetables. They're learning the nutritional content of those, and they're actually learning. They're learning about gardening as well, because one of our champions, Way Farms from Pike County and Ross County, have partnered with them to sort of give them guidance and help them with making sure that the garden comes in the way that it needs to, and any education that needs to happen there. So it's a great project that covers a lot of bases, and the kids have recently been picking the vegetables and trying them, which has been great to watch. We've gotten to see lots of great pictures of them enjoying what's coming out of the garden. So
Good.
It's been great.
A lot of kids don't have the opportunity to learn gardening, and that's a lifelong skill.
Mm-hmm.
If they learn as a child, they can have fresh fruits and vegetables their entire life.
Yeah.
So Kim Hardesty, what are some of the areas that you're working on at the Health District, Ross County Health District, to impact our community's health?
To tag on to what Steve and Kim have talked about, we have a Creating Healthy Communities grant, and we do a lot of policy systems and environmental change projects. So some of the projects we've worked on this year, and we couldn't do this without our partners. Our partners it's crucial to have these strong partnerships to help us lead these projects and support our projects. But and an example of the garden that Kim was talking about, we partnered with the Ross County Library, and we have an edible orchard that we installed this spring. So it has fruit and vegetables, or it's an edible orchard. So there are fruit trees, sunflower seeds that will be blooming, and we'll be able to eat the produce off those. So that's a really neat project that we've started this year. We've also had a bicycle rodeo, so we can increase activity in children, so they know from the beginning how to safely ride a bike and can be lifelong bicycle riders and do that safely. We've also worked on complete street policy, where we want to integrate bicycle lanes, so to expand bicycle lanes throughout the community so we can have more bicycle riders in the downtown and Ross County area. So those are a few of the projects that our Creating Healthy Communities program has worked on.
Those all sound really creative as well, and I know that the library has really, they don't give out books. You can get a bike. You can check out a bike.
The Book a Bike program
Yes.
is an example of a Creating Healthy Communities project.
Mm-hmm.
Yeah. That was a partnership with Ross County Health Districts and the Live Well Committee, subcommittee, and the Ross County Library.
So I understand that you also coordinate the Breathe Well.
Mhm.
What is that program about?
Breathe Well Ross is our lung and respiratory subcommittee of Partners for a Healthier Ross County. And our goal is to reduce initiation of tobacco use in youth. So we want to provide education and materials to decrease that initial use with youth. And then also for individuals who are currently smokers, we want to make sure they know the cessation services that are in our community, and provide the education component as well. So we do that through policy and education.
Great. Hippocrates said, food is medicine. And we're talking about ways of getting those fresh fruits and vegetables. What's available in our community? And I know the OSU Extension has a program. What's available in our community for folks who don't watch the home cooking shows, or they don't have much experience in the kitchen? What are some things that the OSU Extension is helping us with?
So they help Adena with a program called Cooking Matters, which is a nutrition education and cooking class program that they've done in person for years. Last year we did it virtually. They'll probably continue a virtual component of that as long as we have to. But essentially, it was a fantastic program that it was 6 weeks long. It walked folks through reading labels and things like that, understanding their sodium intake and carbohydrates and all that kind of thing, but also utilized fresh fruits and vegetables from the area to create a new recipe every week. They got free groceries each session that they went, and if they completed 80% or more, they got a free cooking tool as part of it, like a crock pot or something like that. So they've done a lot of great stuff in terms of providing that education for folks that maybe they've had a change in their life and they're not used to cooking for one. That we've had folks like that versus cooking for a whole family and trying to get your kids more involved in the cooking process. They can really serve a lot of needs that way. Yeah.
Okay, great. So we've covered a lot of territory, and I'm sure that we've overlooked programs and partners. So I want to give everybody one last chance, starting with Megan. If there's anything that is unique to Fayette that your public health department is accomplishing, or what you have on the horizon, we'd love to know about that.
We just really work with our community action a lot for the substance abuse, and they worked with us for getting more the Healthy You and the Balance Matters programs out to our senior citizens. We work with, they started a drug coalition that they have done, and they were doing some also for the teens to try to get this tobacco use down, some help that way. So,
Are you rolling in vaping reduction as well with the tobacco?
I believe so. That's not a program that I was directly with, but I think it was in general, all of it to do. So
great.
Yeah.
And Kim Hardesty, what are some of the other things that the Ross County Health District are accomplishing?
We're working on the Creating Healthy Communities grant, so we're reapplying right now for next grant year. So there'll be new projects we're working on. So I encourage people to follow our Facebook, follow our webpage to see what those developments are. We are kicking off our new grant year with tobacco, so we're starting to get out and do community education again. Thank goodness we're able to do live events and be one-on-one and group events instead of virtual. So thankful for that. So we'll be out in the community providing that education, working on policy. And then we also have mobility management, which if they have issues getting to their doctor's appointments or to any transportation needs they may have, we can help find them solutions to their transportation as well. And a lot of the information is frequently on our Facebook page. So if you have social media, I encourage you to continue to look at our Facebook page and follow some of our events.
Oh, thank you so very much. So as you can see, folks, we have a lot of partners there's no one agency that can help improve our health. We have to take personal responsibility, but there's plenty of help in our community to help you achieve, and maintain a healthy life. So our call to serve our community's mission is met by not just Adena, but by our partners. And we're so thankful for all of our partners that help us have a positive impact on health. So that concludes today's Living Well with Adena. We'll see you again in a few weeks. You have a great day. Get outside and get some activity.
you.